Hi all, I am Dr. Pratima. I am a critical care consultant working at Apollo Specialty Hospital, OMR, Chennai. I work for the Chennai Critical Care Consultant Group. So this session is about surgical site infections, prevention and management. So what is a surgical site infection? Surgical site infections are infection at the post-operative wound site anywhere between 30 days to 1 year. So within 30 days for any normal surgery, and if the procedure involves foreign body implants, it's going to be 1 year. So it can be as early as less than 2 weeks, delayed for 2 to 10 weeks, and it is called a late surgical site infection if it is more than 10 weeks. What are the types of SSIs? So surgical site infection, if it involves the skin and subcutaneous region, it is called a superficial SSI. If it is deeper to it, causing infection in fascia and muscle plane, it is called deeper SSI. And if it is involving the organ and other places around the organs, it is going to be called an organ or a space SSI. How to identify a post-operative wound? So the patient feels unwell, he runs a temperature, he has fever, and look at the wound. It looks red with a discharge which is dirty, and there can be an increase in drain volume, and further investigations like increase in total blood count and imaging as needed if it involves a deep-seated infection. So how do we manage a post-operative wound? So once we identify, we take a blood culture and wound swab culture, administer proper antibiotics, and wound debridement is very, very important. We avoid tight dressings, and regular cleaning and dressing of the wound is very important. And very important is improving the patient's nutrition so that the healing happens better. So more than management, we need to concentrate on the prevention of SSIs. So we need to know the patients who are more liable for these infections. So patient factors which are unmodifiable or increase in age until 65 years of age. If the patient is elderly, if they have a skin or a soft tissue infection or a recent radiotherapy, these are all factors which point towards incidence of more SSI. There are also modifiable factors like uncontrolled diabetes, obesity, malnutrition, current smoking, and immunosuppression. So there are also investigations which point towards a less nourishment of the patient, preoperative albumin less than 3.5 milligram per deciliter, total bilirubin of more than 1, preoperative hospital stay at least 2 days before the surgery also increase the incidence of SSI. Apart from the patient-related factors, there can also be certain risk factors in the preoperative, intraoperative, and postoperative period. So the preoperative risk factors, procedure-related if the surgery is emergency and more complex, if the wound classification is higher, and if it is an open surgery. Facility-related risk factors are if there is inadequate ventilation in the operation theatre, increased operation theatre traffic, and if there is inappropriate or inadequate sterilization of instruments and equipment. Preparation-related risk factors are pre-existing infection, inadequate antiseptic skin preparation, wrong preoperative or inappropriate hair removal, wrong antibiotic choice with respect to administration and duration. Intraoperative risk factors is long operating time, blood transfusion, asepsis and surgical technique, hand or forearm antisepsis and gloving techniques, hypoxia in the patient, hypothermia, and poor glycemic control of the patient also causes increased risk towards the SSI. One of the most important factor is the type of surgery. If it is a clean surgery like a hernia, breast, or a thyroid surgery, the incidence is less than 2%. The clean contaminated surgery like a lap chole or infected appendix, it is an incidence of 2 to 8% of SSIs. Contaminated surgery as in an open colectomy or appendicectomy is 2 to 8%. Dirty and infected surgeries like debriding, necrotic ulcers, the incidence is as high as 40%. So the postoperative risk factors are hyperglycemia and diabetes in the patient, postoperative wound care which is not appropriate, and if there is an increased transfusion rate in the patient postoperatively, that increases the risk of infections. There are many risk factors, too many individual variabilities for each patient. So we need to be very careful about how we take the patient through the surgery for a good surgical outcome. So there are a lot of surgical communities and societies who have sat together and brought about a lot of bundle care and institution protocols which can be used as checklists. So the pre-op recommendations, what do we need to check? We need to optimize the patient status with respect to the glycemic control and the nutrition. So the patient should be given a good soap water bath with chlorhexidine at least 8 hours to 10 hours before the surgery. So there should be electrical clippers used to remove the hair in the surgical site. and it is better to avoid shaving as it causes minor abrasions in the skin, which increases the surgical site infections. And hand hygiene is very important. Wash with antiseptic soap, alcohol-based hand rub. Nasal swabs for MRSA are not indicated in all the surgeries. It is done in cardiothoracic and ortho procedures only. Antibiotic prophylaxis is very important, and antibiotic dose needs to go in the patient before 1 hour of the incision. So it is up to the institution protocol for which antibiotic is chosen and which needs to be administered. So intraoperative recommendations are better to maintain normothermia. The theatre should be well made, well set, and theatre staff should be wearing very clean scrubs. There should be sterile environment. The volume of the patient, he should not be overloaded with fluids. Wound irrigation is very important, but antimicrobials is not recommended. Simple saline is enough. Drapes or iodophores are used only if the infection rate is very high. Laminar flows is very important in the theatre. The flow of the air should be from up to down, not the other way. And limited use of diathermy definitely helps in avoiding the infection rate. Restricted traffic is also very, very important inside the theatres. Next, we look at the post-operative recommendations. So wound dressing post-operatively is very important. Removal of the drain at appropriate intervals whenever it is required. And the nutrition of the patient, early nutrition, normothermia, normovolemia, early mobilization, physio, and wound care is very, very important. We need to look out for discharges, redness. If the patient has fever, we need to immediately attend to it. So these are the post-operative recommendations for preventing surgical site infections. A basic bundle care is important for every patient who undergoes a surgery, like preoperative bathing and showering, surgical antibiotic prophylaxis, hair removal, skin preparation, surgical hand scrub preparation. To summarize, SSIs are preventable. It is a quality indicator with strict guidelines and protocol. It reduces the morbidity, length of stay, and mortality of the patient. Each institution should have an appropriate bundle and protocol for the prevention of SSIs. Thank you.